Hey, my name is Kara. I'm an ultrasound tech, and let's talk today about a message that I got from one of my followers a little while ago asking if I could do a video on C-section scar pregnancies. Now, for those of you that do not know, this is a super rare thing, and basically what happens is the gestational sac and the whole pregnancy essentially implants inside the C-section scar, or at least around where the scar tissue is, instead of in the endometrial lining in the uterus. So although the C-section scar is obviously in the uterus, it is on the anterior side of the uterus. There is basically just scar tissue there, and it is not the usual place for things to implant. So therefore, it doesn't have the normal blood supply. It doesn't have all of the normal vasculature that is needed for a normal healthy pregnancy. So therefore, when a pregnancy implants inside that scar tissue, not only is the tissue there thinner, so therefore when things implant there, it can cause hemorrhage. It also leads to a non-viable pregnancy in the majority of cases. What's interesting, though, about a C-section scarred pregnancy as opposed to just a classic type of ectopic pregnancy, which is outside of the uterus, with a C-section scar one, there is a chance that there can be a live birth from it. As opposed to anything that is outside the uterus, it will definitely not make it past about 8 to 9 weeks usually, but basically non-viable for sure outside of the uterus for the classic ectopic pregnancies. But the ectopic pregnancy inside the C-section scar does have a very small chance that it can actually survive to term and be delivered. With all of that being said, though, it is really rare for an embryo to be able to develop when it implants in the C-section scar. So those cases where the mom actually has the option to continue the pregnancy or to terminate it is again, very, very rare occurrence, but it can happen. And it's also important to note that there is still a lot of debate in the medical community as to whether or not a C-section scar pregnancy is an ectopic pregnancy or if it is just its own category of C-section scar pregnancy. This is because it's technically not outside of the uterus like what an ectopic pregnancy is defined as, but at the same time, it is still implanting in scar tissue that is less than ideal for the pregnancy to develop in. So I thought it'd be helpful for us to take a look at a uterus first with just a C-section scar, but no pregnancy. So here's where the C-section scar is. It's that black area on the top side of the uterus, so the anterior side. So with a C-section scar pregnancy, the pregnancy is going to be implanting in that area over here, or at least around it. And this is dangerous because, again, the tissue there is much thinner, which can lead to complications such as placenta accreta or percreta. And also, there is just not the necessary blood supply there in the first place that usually is able to sustain a pregnancy. As opposed to a normal healthy pregnancy, over here is where it should be implanting. Thought I'd get a little bit closer to make it a bit more obvious because this endometrium isn't super well seen, but this area right here, you can kind of see it as like a stripe coming across here. That is the endometrium. So that is the functional lining of the uterus that sheds every month, or when you are pregnant, this is where baby and the gestational sac, etc., should be implanting here because that is where all the nutrients are. That is the right spot for implantation. And here is a picture of a pregnancy that implanted in the C-section scar. So again, instead of planting up over here, where there is the thickened endometrium, where there's going to be the correct blood supply, etc., it implants all the way over here. And like I stated before, in the majority of cases, these pregnancies are not going to be viable. There won't even be an embryo that develops. But in the case where there is an embryo that develops and there is a positive fetal heart rate, then the patient does have to decide whether or not they want to go the termination route, in which they would just go in the anterior side, so basically this side, with methotrexate or a different type of medication that would do the same thing to stop the pregnancy from progressing. Or if the patient does decide to continue on with the pregnancy, then she will be at a high risk of complications. So both her life as well as baby's life is going to be at risk, and it will definitely be considered a high risk pregnancy. Things such as preterm labor are definitely going to be on the table for this kind of pregnancy, as well as more fatal things such as hemorrhage, which is where you are internally bleeding a lot. Your uterus could rupture, you could have placenta accreta, which is essentially when the placenta implants too deeply into your uterine wall, and therefore during birth as well as after, there is a high risk of bleeding out. or the risk of placenta percreta is increased as well. And this is where the placenta not only implants deep into the uterus, it actually implants all the way outside of the uterus and attaches to other organs such as the bladder, which obviously is not good. And with all of that being said, in the majority of cases where the pregnancy does go to term, or at least gets to a place where they can deliver a baby, not only is a C section going to be required, but a hysterectomy is almost always in the cards as well. Obviously, they will try their best to save the uterus, but in the end, when you have a pregnancy that is implanted somewhere where it should not be, it does create a whole host of other issues. So even if you do make it to term or to a place where you are able to deliver safely or baby is developed properly, then you will get a C section anyways, as well as, again, you do have a high risk of having a hysterectomy as well. And here is just another picture of a C section scar pregnancy. So, again, it is implanted up over here. That is just that black area there. And instead, it should be over here, more high up in the uterus where the endometrial lining is, but instead, it is again way down there. And as a final point, there isn't anything that you can do to lower your risk or to prevent it, but it is just a rare thing. I think it happens in about 1 to every 1,800 to 2,400 pregnancies. But in the end, that is why scans are so important in the first trimester around the 7 to 10 week mark, or even earlier sometimes is also recommended if there is a history of ectopic pregnancies, etc., or even just complications, to be able to detect these things early on, and then you can make informed decisions from there.